Ever pondered how diuretics work in our body? These pharmacological agents play a crucial role in managing conditions such as hypertension, heart failure, and edema by stimulating our kidneys to increase the excretion of sodium and water. So how do diuretics achieve this? They act on different parts of the nephron, the functional unit of the kidney. Their main mechanisms of action include inhibiting sodium reabsorption, altering electrolyte transport, antagonizing aldosterone, and creating osmotic effects. For instance, some diuretics inhibit sodium reabsorption in the renal tubules, causing an increase in sodium excretion in the urine. This process osmotically draws water into the urine, thus increasing urine volume. On the other hand, loop diuretics inhibit the sodium-potassium chloride co-transporter in the thick ascending limb of the loop of Henle, leading to increased excretion of sodium, potassium, and chloride. Potassium-sparing diuretics like spironolactone block the effects of aldosterone in the distal tubules and collecting ducts, leading to increased sodium excretion and potassium retention. Lastly, osmotic diuretics like mannitol increase the osmolarity of the glomerular filtrate, inhibiting water reabsorption and increasing urine volume. There are several types of diuretics, classified based on their site and mechanism of action. Thiazide diuretics, for example, act on the distal convoluted tubule to inhibit sodium reabsorption. Loop diuretics inhibit sodium, potassium, and chloride reabsorption in the thick ascending limb of the loop of Henle. Potassium-sparing diuretics inhibit sodium reabsorption and potassium excretion in the collecting ducts. And osmotic diuretics increase the osmotic pressure in the nephron, inhibiting water reabsorption. These diuretics have various clinical applications. They are often used as first-line agents for the treatment of hypertension, particularly thiazide diuretics. In heart failure, they reduce fluid overload, improving symptoms such as dyspnea and edema. They are also used to reduce edema in conditions such as liver cirrhosis, nephrotic syndrome, and renal failure. And in cases of hyperkalemia, potassium-sparing diuretics help reduce potassium levels. In conclusion, diuretics play a significant role in the management of various medical conditions. Understanding their mechanism of action, types, and clinical applications is essential for their safe and effective use. But remember, regular monitoring of electrolytes and renal function is vital to prevent complications associated with diuretic therapy.